So our next topic is autism. It usually develops after 3 years of age, and it is common in male children. Three features must be present to make a diagnosis of autism, that is global impairment of language and communication, impairment of social relationship, and ritualistic and compulsive phenomena. Most of the children with autism have a decreased IQ. The seventh is rare. The seventh syndrome is usually a condition in which a person with the mental disorder have a high IQ. So mostly the children with autism have a decreased IQ, but sometimes an increased IQ can be present. In this case, we label it as seventh syndrome. Now, we saw that three features must be present to make a diagnosis of autism. That is global impairment of language and communication, and impairment of social relationship, and ritualistic and compulsive phenomena. So now, what kind of ritualistic and compulsive behavior can be present in children with autism spectrum disorder? Ritualistic behavior may be defined as a sequence of action, a thought, or a sequence of thoughts that are repeatedly performed in an attempt to manage anxiety. For example, some children might keep their favorite objects in specific places, like the bottom corner of a drawer in the bedroom, and they might have to get their objects out and touch them before going to bed for sleep. So ritualistic behavior and compulsive behavior, such as repetitive body movements, hand flapping, rocking and spinning, moving constantly. So these features need to be present to make a diagnosis of autism spectrum disorder. Autism spectrum disorder is sometimes associated with the Rett syndrome. Rett syndrome is a genetic neurological disorder that occurs almost exclusively in girls and lead to severe impairments, uh, nearly affecting every aspect of child life, that is their ability to speak, walk, eat, and even breathe easily. And the hallmark of Rett syndrome is near constant repetitive hand movements. So sometimes autism spectrum disorder is associated with Rett syndrome. So three features that need to be present to make a diagnosis of autism is global impairment of language and communication, impairment of social relationship, and ritualistic and compulsive phenomena. So if a child present to you with these three features, then your diagnosis will be autism spectrum disorder. Seventh syndrome is a rare condition in which the person with developmental disorders, such as autistic disorder, have an amazing ability and talent and high IQ. So if these features are present in a patient with a developmental disorder or neurological disorder, such as autistic disorder, then we will say that it is seventh syndrome. So another feature that can be given in the Plab 1 exam sometimes is that in the child with autism spectrum disorder, there is a preference for only specific hobbies, such as collecting of the toys. And a variant of autism is Asperger's syndrome. Asperger's syndrome is that normally, most of the time, the IQ of the children with autism is decreased. But if a child with autism is high functioning, or his IQ is average or above average, then it will be known as Asperger syndrome. So a high functioning autism with average or above average IQ, our diagnosis will be Asperger syndrome. The management of autism is behavioral and developmental programs and speech and language therapy. For example, let's do a scenario how a question about autism is going to be asked in the Plab 1 exam. After moving to a new school, a 15-year-old boy performed poorly in school, poor performance in the school. So this point is important after moving to a new school. Usually the children with autism, they develop these symptoms when there is a change in their life. Whenever there's a change in their life, such as moving to a new school or the death of a loved one, they usually develop the symptoms of autism. A 15-year-old boy performed poorly in school. He has very little interest and social interaction. He has got very few friends and finds it hard to express himself. So after a change in his life, he developed impaired social relationship, social interactions. He has got very few friends and finds it hard to express himself. That is global impairment of language. He prefers solitary activities. His teachers often complained that he was seen organizing his stationaries on his table, counting up to 20 each time. So this is ritualistic behavior. That is organizing his stationaries and counting up to 20 time each. And if disrupted, he would be very anxious and upset. Collecting toy cars is one of his interests. He has over 2,000 toy cars and often spent hours lining them up. What is the most likely diagnosis? So a child who is 15-year-old after a change in his life, that is moving to a new school, he developed social impairment, global language impairment, and compulsive or ritualistic behavior. That is organizing his stationaries and counting them up to 20 times each. And also he has a preference for specific hobbies such as collecting toys. So these hints will be given to you in the exam to make a diagnosis of autism spectrum disorder.
What's the difference between Asperger syndrome and seventh disorder? Because in
Asperger
both of
syndrome is
them,
a variant. Asperger syndrome is a variant of autism, and in Asperger syndrome is basically high functioning autism, and Asperger syndrome IQ is average or above average.
but in seventh
While in
disorder,
yes, in seventh syndrome, the IQ is usually high, and seventh syndrome can occur in any mental condition or any developmental brain problem, not just only autism.
right?
Any developmental brain problem. If a person has any developmental brain problem and he is a high IQ, then we'll call it as seventh syndrome.
Right.
While Asperger syndrome is specific for autism. It is a
Okay.
variant of autism, you can say that.
Right. Thank you.
So this was all about autism and its management. I hope it's clear to everyone. Are there any more questions? Okay, our next topic is attention deficit hyperactivity disorder. Now, what is attention deficit hyperactivity disorder? Because of inattention and attention deficit, it is also a disease that is commonly found in children that three things are present in the children, that is inattention, second one is hyperactivity, and third one is impulsivity. These three things are present, the features of these three things are present in the children, then your diagnosis will be attention deficit hyperactivity disorder. So first let's discuss what is inattention or attention deficit. That is, does not follow through on instructions, reluctant to engage in mentally intense tasks due to inattention, easily distracted, finds it difficult to sustain tasks because he easily get distracted due to attention deficit. Find it's difficult to organize tasks or activities, often forgetful in daily activities, often loses things necessary for tasks or activities. So basically, these are the features of inattention. Now, what are the features of hyperactivity and impulsivity? Along with these features, the features of hyperactivity such as unable to play quietly, talks excessively, do not wait their turn easily, will spontaneously leave their seat when expected to sit because they are hyperactive, is often on the go, always in a hurry. They are often interruptive and intrusive to others. They does not let other complete their questions or their talk, and they answer prematurely. So an attention deficit, hyperactive and impulsive child, your diagnosis will be attention deficit and hyperactivity disorder. For example, a 6-year-old boy is brought by his mother. She says that he is easily distracted. So this is a feature of inattention or attention deficiency. Interrupts other students when it is their turn to answer the questions. So this is impulsivity. He is also careless, not able to do tasks for a long time, and is unable to play quietly. So this is also hyperactivity or impulsivity. So this is attention deficit and hyperactivity disorder. Another example, an 8-year-old boy who was brought in his by parents because of some behavioral problems. In an interview with the teacher, he was described as naughty, easily distracted, and sometimes aggressive. So inattention and impulsivity, his parents say that he has always had difficulty concentrating on tasks since infancy. What is the most likely diagnosis? Again, attention deficit hyperactivity disorder. In autism spectrum disorder, there was global impairment of language and communication, social problems, and ritual or compulsive phenomena. Asperger was a variant of autism spectrum, and we have already discussed attention deficit hyperactivity disorder, and we are going to discuss this Tourette syndrome and oppositional defiant disorder. They can also be present in children in the coming slides. For now, we'll just keep our focus on attention deficit hyperactivity disorder. That is uh, an attention deficit, hyperactive and impulsive child. The diagnosis will be attention deficit hyperactivity disorder. Now, due to attention deficiency, the management of such children is they include medication such as methylphenidate. It improves concentration, and the other is CBT, that is ADHD focused group parent training program, in which usually parents are involved and they are guided about how to handle their child with attention deficit hyperactivity disorder. In adults, the management of attention deficit hyperactivity disorder is methylphenidate as well as uh, lisdexamfetamine and cognitive behavioral therapy as well. So management is almost same in children and in adults. Uh, this drug is an additional drug that can be used in the adults for the treatment of attention deficit and hyperactivity disorder. So Tourette syndrome is also present in children. What is Tourette syndrome? In Tourette syndrome, the child is usually male and 6 to 8 years old. Patient with Tourette syndrome will have tics. What is tics? Tics is usually repetitive movements or gestures that are disruptive in classroom or to the people around a child. Now these tics or these movements, they can be motor or they can be vocal. Now motor tricks include jerks, blinks, sniffs, nods, spitting, stuttering, and vocal tics. They include irrepressible, explosive, obscene verbal ejaculations, grunts, and squeaks. So they will repetitively make grunts and squeaks or obscene verbal ejaculations or repetitive jerks, blinks, or sniffs. So if these features are present in a child, then your diagnosis will be Tourette syndrome. The treatment is either a risperidone or haloperidol along with CBT, cognitive behavioral therapy. Now, what are the clues to make a diagnosis of Tourette syndrome in Plab 1? The child yelling in class intermittently or shouting explicitives, then this can be a clue to make a diagnosis of Tourette syndrome. If only tics are present, then the diagnosis will be Tourette syndrome. If along with tics there is impairment of social skills, social isolation, then the diagnosis will be Asperger or autism spectrum disorder. So only tics, the diagnosis will be Tourette syndrome, and tics along with impairment of social skills, the diagnosis will be Asperger syndrome or autism spectrum disorder. So these were some conditions that are present in children, such as autism, attention deficit hyperactivity disorder, and Tourette syndrome. I hope it's clear to everyone. If there is any confusion, you can clear your confusion by asking questions.
So, what is the cause of this Tourette syndrome? Is it like a
The
genetic
cause is
or
usually a genetic syndrome.
okay?
Uh, the cause is usually genetic due to genetic derangement in the neurotransmitter levels. These tics they can.
And the treatment for autism. Uh,
The treatment for autism was language and behavioral programs and CBT. There is usually no drug treatment available for autism.
so can melatonin be given to autistic children? Because if they become hyper.
If children present to you, the children has a history of autism or attention deficit hyperactivity disorder, and he also has insomnia, then first you will advise sleep hygiene, and if still the child is insomniac, then melatonin can be prescribed.
So it can be prescribed for a short term or uh, I
It
mean
can be
this mal.
prescribed for long term.
Okay,
Only if the child has sleep problems. Otherwise, there is no need to prescribe it. When
okay,
any autism or ADHD or any other disease in children.
okay. Thank you.
Any more questions? So we'll end our lecture here today.